The federal government has bought 500,000 doses of bird flu vaccine to make sure Canada is ready for any potential threat that the virus may pose. The Public Health Agency of Canada says the move is a proactive measure, adding that the shots are meant for people who are at increased risk, such as those who have ongoing contact with infected animals. 60% of doses will go to provinces and territories, while 40% will stay in a federal stockpile. According to health officials, the risk to the general public is low. Canada reported its first domestically acquired human case of avian influenza in November. Joining me live now with more is Dr. Fahad Razak, an internist at St. Michael's Hospital. Doctor, good to have you tonight. Thanks for taking the time.
Good to see you, Lindsay.
I know you've spoken a lot before about different viruses and vaccines and about how our government should be proactive when it comes to vaccines. So what's your reaction to this?
I think it's an excellent move. So you're right. We've talked about this before, and you never want to be caught flat-footed, have the virus start to emerge and spread more widely, and then not have access to that vaccine. So this is an appropriate proactive step. 500,000 doses for a country our size, I think, is an appropriate number. And also in accordance with the guidelines, they're targeting it to those who would be highest risk. As you said, agricultural workers, people who may be exposed to the virus in a laboratory setting, food handlers. So this is a very appropriate purchase, and I think set of recommendations to help protect the public.
So does this mean people can actually go and get these vaccines soon? I mean, you just mentioned those who are at highest risk, but I mean, for people watching at home and thinking, should I be getting this? Should they?
They shouldn't. So this is very targeted. This is, I think, part of the recommendation here is to also say for the general public, based on what we know of this virus currently in its state, it is not a high-risk entity for the general public. So if you're like me or you're not exposed to birds who are influenza positive, you're not an agricultural worker, this is not a vaccine for you. But this very much is going to protect our workforce. And I think there are people in this country who are in high-risk settings. It also means that there's less opportunity for the virus to spread in humans. And the real concern, of course, is that once you get continued human exposure, let's say in agricultural workers, you create an environment where now the virus can mutate further and start to spread more easily within humans. And that's the scary event we want to prevent. And part of breaking that event from occurring is this pathway of preventing exposure in the first place.
Yeah, I think we're familiar with that happening with COVID-19, obviously. What do we know about bird flu in Canada? Because obviously it's been quite destructive in some parts of the U.S. so far, but what do we know about it being in this country?
So far, just very limited examples of it occurring. And I think the case that's on everyone's mind is the young woman in British Columbia who did get very severe disease, thankfully out of hospital now, not really known how she was exposed. The predominant exposures in North America right now are agricultural workers in the United States. Most of the cases, thankfully, have been quite mild. There have been a couple of severe incidences of disease also in the United States. So I think right now we're still in a situation where we're seeing worrying spread in other mammals and other animals. We have some human exposures, but thankfully no evidence yet of human-to-human exposure. And you're seeing countries widely now across the globe, the United States, many countries in Europe, are purchasing the vaccine and targeting those who are high risk. And of course, as we talk about this, I think we should not lose sight of the fact that as of this week, we still have very high levels of conventional flu spreading in the Canadian population. So even though this vaccine is not for the general public, the recommendation is still very strongly the seasonal influenza vaccine has a very important role. And I think to tie it to this story, you don't want this version of influenza mixing with conventional influenza, because again, it enhances the chance that you could have enhanced human-to-human spread if that occurs.
By mixing, do you mean having influenza as well as like the bird flu on top of that? Is that what you mean?
Correct. And that's a high-risk scenario for the virus to start to mutate more aggressively. So we know normal seasonal influenza can spread very easily from humans to humans. We know right now that avian influenza cannot spread easily. The reason you want to protect the public, the reason you want to immunize those who are at highest risk is you want to prevent overlapping infections on individuals, swapping of genetic material between the virus, and then picking up that ability for avian influenza, which is much, much more severe, to start to spread between humans, just like seasonal influenza.
Very interesting. Okay, Dr. Fahad Razak, really appreciate you taking the time tonight. Thanks so much.
Great to see you, Lindsay. Thanks.